May 7th evening, so around 11 p.m. EST, we're going live. So Wednesdays are generally my clinic days. So what that means is that that's when I see most of my patients. There's an interesting concept that I learned. This will be a good productivity tip and a good business tip, is that you want to stack things that are together for productivity. So if you have ADHD, this will be really helpful. So for example, let's say you're like hopping between, like for me, right? If I'm trying to hop between like seeing a patient and then like working on an email and then recording a video and then doing a business task, and then brainstorming like a script and then seeing a patient again, then all of that stuff kind of links in together. And basically, I can't really get anything done well. But if I set specific days or specific chunks of time, like, okay, these next couple hours, I'm only going to script videos. These next couple hours, I'm only going to record videos. This whole day, I'm only going to see patients. And so when you do that way, when you structure all of your content and your tasks in one specific thing in blocks, then you will be able to be way more productive than if you are trying to hop from task to task to task. So that's the reason that I structure all of my business For example, I'll have a day that's just like, okay, I'm not doing anything. I'm just going to do pure business stuff. If I have another errand day, it's like, okay, I'm going to try to put all of my errands into this one day. Same thing with my patients. I'm like, okay, I'm going to try to see all of my patients on Wednesday. And that way, if I see my patients on Wednesday, I'm in that patient mood. I take care of all their stuff. And then, that leaves Thursday, Friday, and then all the other days to work on something else. So, for example, tomorrow's like a big errand day. So I'm going to be working on some errands that I have to go to the dentist. I'm going to be doing some errands for my practice. So just doing all of that. But then that leaves Friday completely open. So that way on Friday, I'll really have the time to be able to work on my business stuff. So that is my current goal right now. Basically, just I want to space things out so that way it's like structured best. So for example, next Wednesday, I think I have like 10 or so patients, 2 intakes to do, but that's why I'm trying to just get everything all together done at one point, right? So I'd rather do that, just like knock them all out. So J Colo 679 says, hi, I love your videos. Thank you. I appreciate that. N3VRB Erd says, are you practicing in Canada or the US? So I am in the United States. I live in New York. Currently, I'm in Michigan right now, just visiting family. But I live in New York City normally. So I practice in the US. So I have a bunch of state licenses across the country. But I have seen some Canadians before as well too, mainly for consultations. So I have some Canadians who reach out to me for consultations because they're like, hey, I want to consult, or like, I'm not able to get good care here, so that's why I need to consult you. Okay, so BAM02 says, when do you use hydroxyzine versus propranolol versus clonidine? That's a good question, actually. I use propranolol if there's a performance anxiety component. I think of that as like the best, most tolerated, but it might not be less effective. Propranolol is good for the physical anxiety, but it's not good for the emotional anxiety. I use clonidine for ADHD type of hyperactivity. I don't use it for anxiety primarily. Excuse me. But I'll use it for like sympathetic nervous system overhaul. And then I use clonidine or hydroxyzine for just straight up anxiety and also for sleep. Are you licensed in Ohio? I am actually, yeah. So I did my residency in Michigan. And so I spent 3 years in Michigan. My parents live in Michigan. So I see a fair number of Michigan clients. And yeah, so Ohio came naturally. Bill says, come to Texas and work at the State Living Center. They much need psychiatrists and pay very well. I just have no connections to Texas. All my my family's in Michigan. My friends are all in New York, right? Once upon a time, maybe I would have thought about Texas, but I have no reason to go to Texas. I like the South. Like I did college and med school in Alabama, so I'm very familiar with the South. I like it. Um, but yeah, also I can't work for anyone else anymore. Like I can only work for myself. So I'm not looking for an employer, right? So I'm not looking to be paid well. I'm looking to generate revenue for my business, right? That's the difference. Go Jags. Yes, go Jags, baby. Hi, new here. Welcome, Sheena. Good to see you. Sunny says sertraline versus Lex. Uh, Lexapro is a good starting one. Sertraline is a little bit better for anxiety. It's a little bit more heavy hitter, personally. I've been having nightmares about Mario and Luigi. What does this mean? It means that you need to go play Smash Bros. Or you're just excited for Mario Kart World. That's probably what's going on. Do you see people have success with the right meds plus therapy for bipolars and no hope? No, there's definitely hope for bipolar. Bipolar's been one of those things that's been studied a lot, actually. And, I remember one time, like, I used to do inpatient work. And so I had this one patient, she lived in a group home, and she got off all her meds, and she was found running around the street naked, actually. And so that's when they brought her to the hospital. And so she was very, very, very manic. And so we got her on the right meds. We got her back on her lithium. And within like 2 weeks, she was like normal, talking again. Before that, like she was just like taking off her clothes, being sexually inappropriate. Like I could not be in the room with her without being a nurse, without their nurse being present, because I was like, okay, like this things could go wrong here. I need to protect myself. And so there was always a chaperone because she was just very sexually forward. But yeah, 2 weeks later, like, she was good. She was back on her meds. Her manic episode had gone away, and she was doing well. So yes, bipolar is absolutely treatable. I graduate from the University of Alabama in fall 2026. I look forward to using your program. Thank you. You graduate from NP school or like Psych NP? Jordan says, any insight on using Desvenlafaxine and adding Rexulti? Yeah, those are good. One's an antidepressant, one's an antipsychotic. Rexulti helps for treatment-resistant depression and bipolar treatment. So, yeah, you can do that. Sheena says, I did ECT. Yeah, that's quite the procedure for sure. Have you experienced depression and anxiety yourself? I have not. No, not to a severe level. Halbrand, is there any new promising anxiety or depression meds on the horizon? Ketamine's the newest thing that I think has been taken off a lot. TMS has been taken off a lot too. I don't think I'm not aware of anything that's like new or promising. A lot of that new stuff, like it's all just hype, right? Yeah, I don't think like the industry has cracked the code yet for the next greatest revolution in anxiety and depression. Alternative for benzo for sleep anxiety, hydroxyzine or propranolol, yes. Did she have bipolar? Yes, that patient did. PMHP, yes, roll tide. Yeah, so actually we have a lot of PMHNP students in our program right now. And the reason is because they told me that they wanted, when they went out for their first job, they wanted to feel like they were going to be successful in that job. They don't want imposter syndrome. They wanted to know what they're actually doing. I was talking to my students just yesterday, and they were literally telling me that when you graduate from PMHP school, like, or nurse NP school, or a psych NP school, like, literally, like, no one teaches you anything. They just kind of, like, send you out, and you're expected to just figure it out for yourself. You have to get your own collaborating psychiatrist. You have to find your own mentors. You have to just get started with the job and just hope that you're going to learn everything, hope that you'll be able to use everything with patience, and that's scary. Like I remember when I was in my third year of residency, that's when patients turn over every year to the new residents, and the attending just gave us all, like me and my 5 co-residents, a stack of patients, and they're like, okay, have fun, like now you're taking over these patients, these are your patients. And I was like, oh, Okay. And so I literally remember like sitting there with every patient just trying to figure it out. Like I was searching up to date and reading all the like different books for each patient, searching Hippocrates, just like trying to Google it anytime. Like I was literally Googling meds while talking to the patient because I'm like, I don't know what to do here, but I need to figure it out in this next like 20 minutes because the patient in the interview is like 30 minutes long. So I need to figure out quick what to do. And so that's why, I don't want you to be stuck like that, where you're trying to figure out, okay, what exactly are you trying to do and how, um, with your knowledge, right? And that especially happens for NP school. And like, that's at least what my students told me. So, if you really want to like be that confident NP, right? And you want to get ahead, you want to start your first job knowing psych, like knowing it well and not just like starting off blank, then I think now is the better time to join, especially as a student rather than as a once you're fully providing. Hey, you're a psych doc, a real question. How do you deal with doctors who gaslight you? I don't know if doctors really gaslight you. I think sometimes people come in with the perception that they're going to be gaslit, so they perceive everything as gaslighting. But I would say just come in with an open mind. Come in wanting to work as a team, right? If you already come in with this negative antagonistic energy, then of course you're going to perceive that things are going to be gaslighting. But I'm not saying it doesn't happen, but basically you have to come in with that positive energy too. Alternative. Awesome. Thank you for sharing the live. Yes, please share it. Alternative to benzo for sleep anxiety. Oh, yeah, I answered that one. Yeah. Propranolol, L-theanine, magnesium. Do you recommend Clonidine? I have some patients who take Clonidine. Yeah, and they do well on it. Which antidepressant is less likely to cause mania? They're all pretty much equal. More likely is Wellbutrin, though that's something. Okay, Michelle, thank you for the sub. She says, what are your thoughts on quiet BPD versus regular BPD? I'm not sure what you mean by that, but I assume you mean like how much noise and trouble they make. So quiet BPD is harder to diagnose because it's not as obvious, right? So you're probably less likely to cause damage to your relationships, which is nice. But the downside is you might be less likely to get treatment too. Right, we got 76 people in here, so questions are racing. I gotta blow my nose. Do you feel like you were given too much autonomy in that example, or what was it helped you improve? It's both, right? So the way that you learn is that you have to get to your edge, right? Psych MD. So are you a psychiatrist or psych resident or something? Because then basically that will influence how nuanced I can get in my answer. Hey, today I told my therapist I was severely depressed. I was nervous to put it in. Nice. Yeah, I remember we were talking about that yesterday. I'm glad you were open with them. But to answer your question, PsychMD, so it's a balance, right? I'll assume that you're in training right now. So if you have no autonomy, then you don't learn anything because then you're just following the attending and whatever the attending's doing, and your mind kind of checks out because you're just there. And I've had attendings like that where like they pretty much just ran the show, and I just followed them and watched them. Then you have the opposite where you have a lot of autonomy, and then you're like, oh fuck, like I don't know what I'm doing here. I need to figure it out. So you but it's like when you get thrown in the deep end, right? Like you have to learn how to swim. And so when I was thrown in the deep end, it's like, okay, I need to figure this out, like, or else I'm not going to get through this year. So I did figure it out, and the attendings were available as backup. So that was nice. So you need some supervision, but I think you just need enough to make sure you feel comfortable. You need that safety net to where you can try stuff, you can learn, you can make a little bit of mistakes, and it's okay because those mistakes are how you're going to learn and remember. So I think you need most autonomy, but you need that support and structure around too. Incoming psych resident. Oh, I see. Okay. Yeah, then you'll see that pattern where at first year they're gonna handhold you a lot, and then by the time you get to fourth year, then you'll be running the show. Like I remember when I did my inpatient unit or my rotations, I was a first year. We had a fourth year on the team, and then we had an attending, and like this attending was very hands off. He'd worked there for like 20 years, and so he was like, okay, the fourth year is running the show. You, the first year resident intern, you report to the fourth year, and then the fourth year will make the treatment decisions, and then I'll sign off on everything. I only do online consultations, yeah. Yeah, best way to do that is in my bio. So yeah, because I call you, that's what the consultation is. But then a full psychiatric evaluation is different than a consultation. That's a 90-minute assessment where we go through all of your stuff in detail. So for example, I just had a consult today. Mid-20s patient has some anxiety. They feel like their current psychiatrist isn't helping them. And so they had some questions about their medication. They're like, hey, I'm taking Lexapro. Is this a good choice? What dose is good? And so I gave them some advice on that. And then they were like, okay, I want to transfer over to you. So I gave them some advice, but then now we're going to be doing a full 90-minute assessment where I go into their situation in more detail, and then I could come up with a much more detailed treatment plan for them. What causes a downward spiral and paranoia on meds with bipolar? Lot sleeping. So not sleeping is a big one. I remember I had this patient. She was a EMS driver, and she was my patient in my third year. And then she was supposed to show up for an appointment, but she never showed. So, which was odd because she was normally very good. And I was like, okay, well, shit, what do we do here? And so I called her, like, didn't have an answer. And then fast forward like a month or so later, she comes in and she tells me that she was in the hospital. And I was like, wait, like what happened? How'd you get in the hospital? And so turns out that she was an EMS driver. She came off her psych meds. She was on lithium and Seroquel for bipolar. She came off of them. And she was driving in the EMS. And then her co-partner asked her to pull over. So she's like, okay. She pulls over. The co-partner gets in the car. And then once takes over the driver's seat, has the patient ride in the passenger seat, and then he drives her straight to the hospital because she was driving at like 120, and the street speed limit was like 50. And the reason was because she'd come off her psych meds, she didn't sleep, she was drinking like 600 milligrams of caffeine, a bunch of Red Bulls, because she was also a student at the time, so she was studying a lot. And all of those precipitated a manic episode. So with her, we're like, okay, we need to get your sleep back in order. We need to cut out the caffeine, and we need to get you back on your meds. So basically, yes, that's how you can spiral downward. You have to protect yourself and make sure that your sleep is good. You're not getting too stimulated, and you're on your meds. Yeah. I'm so angry when my dex wears off. I feel like I'm in fight or flight. I've also started sertraline. Yeah, sometimes sometimes it just has to last longer, or sometimes you have to spread out the dose during the day, or sometimes maybe like a propranolol or something can help too. Dude, you gotta stop spamming. I already answered that question. Do you have tips on reorienting someone with hallucinations? Tips on... Yeah, you have to ground them. That's the most important thing. Connect them to the present moment, repeat over and over again. Don't want to argue with them too much. Ground them to the present moment. Encourage them to take their meds again, because usually hallucinations are usually a psychotic thing caused by depression or bipolar or schizophrenia or something. So you want to get that treated too. That's also important. How difficult to not realize you're sleeping mania? Yeah, one of the first signs is sleep. So if you notice your sleep is getting worse, that's a sign, and it like stays that way. And people are saying you're talking too fast, you're behaving a little bit crazy, you are feeling more impulsive, you're feeling energized, those are signs. Would you suggest for someone who gets really nervous when public speaking? Yeah, propranolol for sure. That's a good one. And just, deep breathing as well, too. And also just acknowledging that sometimes nervousness is also excitement. So, and also acknowledging that pushing through it is ultimately the only way that you're going to conquer that anxiety. Why don't more psychiatrists check vitamin D levels, which cause anxiety and depression? Because it's not something that we're taught. So, I remember when I was in my third year of residency, right? So we were doing all the outpatient work with patients. And I think that I only checked vitamin D maybe like 2 or 3 times during that whole year. Uh, just because like it wasn't something that was really emphasized in our training. But then now in my private practice, like I check vitamin D with pretty much every patient I get labs on because I'm like, yeah, I think it's so important. That's like one of the core supplements I take every day. I recommend all my patients to take it because the vast majority of people are low. So it's like, okay, you might as well just take it and get some benefit from it. Do antipsychotics change your metabolism? They do, yeah. They lower your metabolism. And they can increase cravings too. Why are we seeing spikes in autism diagnoses? So we're seeing spikes in autism diagnoses because just more people are aware of it. But also it's kind of like the cool thing to do too. I think that's kind of a part of it. Like everyone's self-identifying now as autistic or ADHD, right? Without actually fully receiving the diagnosis because it's like cool to do so, thanks to TikTok and social media. So I think it's a mix. What levels do you see in severe psychosomatic patients? Uh, it's not really correlated with vitamin D. It kind of works with everything. Where are you located? I live in New York, so I live in New York. Yeah, New York City. But I'm currently in Michigan right now. But I see patients remotely all across the country because I have a bunch of state licenses. How to how to safely come off Seroquel. Yeah. Best way, so you can look me up. Best way to do that is just look on my website. That's the best way. Excuse me. I just hugged my cat before this, which was probably not a good move. But hey, we love her. What is your go-to for someone with ADHD? What is your first go-to with someone? Stimulant. I'll either start with the methylphenidates. What do you do when weight gain isn't an option, but you need antidepressants? You use Wellbutrin. You also exercise, you control your diet, right? Ultimately, the weight gain happens because of the food choices that we choose to put in our mouth, right? So antidepressants can increase cravings, they can mess with metabolism a little bit, but ultimately, we choose to put that food in your mouth. So the advice I always tell people is control your environment for that. So for example, I remember I used to have a big dessert craving, and after every meal I have to eat a dessert. Like it's just like, you have to end the meal with something sweet. And I would always use ice cream and cookies or chocolate. I would always have something available, and I would be like, okay, I'm going to dedicate a couple hundred calories of my meal to this. And then I discovered this recipe of Greek yogurt plus blueberries, strawberries, plus protein powder, and then I would mix in a protein bar with it. And that was around 400 calories-ish, 500 maybe, and it's like 68 grams of protein. And then ever since I did that, I got rid of all the dessert food at my house. And now that literally is the best dessert that I can have. I love that. And then from that, I realized that, okay, if I just got now in my house, I only have protein bars. Like that's legitimately the only dessert I have. So that's the only thing I can eat. The rest is just like protein and veggies. That's all I have in my house. So I'm like, well, shit. Now I can't eat any dessert. That's the only option I have. So similarly, if you're worried about weight gain, that's one of the best things you can do is just control your environment. Make sure you don't have access to any bad foods. I do Greek yogurt and blackberries. Yeah, it's a lot easier to control your environment than it is to control your willpower. That's why most people binge eat at night, because their willpower dies down. Just checking if I got a message. I'm on call right now. Yes. Do you know anything about the supplement Stasis? I don't know. I've seen a lot of their ads, but I don't know too much about it. It's like ADHD. They're basically just advertising to the ADHD crowd, you know, saying, hey, this will work better than stimulants, or yeah. If you put honey under your tongue, it can make sugar cravings go away. Oh, that's a good trick. Yeah, I know honey is a natural sweetener, right? So a lot of people do that. Any advice on how to choose a specialty? If someone put a weapon to your head, what would you pick? What are your thoughts on atypical antipsychotics for mood disorders? Yeah, I use them. They're used as adjuncts, so I wouldn't use them first line, but you can definitely use them after the fact. So I'll use Seroquel and Abilify. Those are my top two adjunct ones, and Vraylar too. Are SSRIs your favorite antidepressants prescribed first line? I like Prozac or Lexapro personally. Can guanfacine be used during the day? Yeah, it can. What about metformin or Topamax? Yeah, I remember one person in the live came to me and they were like, hey, I'm a med student, convince me to go into psychiatry. And I was like, bro, psychiatry is competitive at AF now. I don't need to convince anyone to go into it. And if you need to be convinced to go into psych, then it's not for you. How about anxiety meds that aren't dependent, not including propranolol or hydroxyzine? Yeah, then SSRI, L-theanine, magnesium, some supplements. You need a hug. I'm good. Rexulti versus Abilify. Abilify's cheaper. Rexulti can be a little bit more expensive. Excuse me. Thank you for sharing, though. I take Lexapro and now on Strattera. Will that help my lack of motivation? I take Lexapro and now on Strattera. Yeah, that sounds like a SNRI combo now you got going. But motivation is, you have to have a reason to be motivated. It's like, imagine if I told you to just get in a car and start driving. You'd be like, like a Toyota Camry, not like a sports car. You'd be like, why? Exactly. There's no motivation. There's no reason to drive. But now, let's say I told you that you have to drive to a grocery store because we have no food. You're like, oh, okay, now you have a reason to drive because we need food. So similarly, when people tell me motivation, I'm like, well, it's probably not just a motivation thing. It's more of a reason thing. Like, what is your reason for wanting to do stuff? And that's what you got to figure out. So you need a reason and you have to know what to do. So it's like, now let's say I told you to drive and the reason is because we have no food. Okay, now great. But now where are we going to drive to? Are we driving to the grocery store? Are we driving to the supermarket? Are we driving to the farm? Are we driving to a restaurant? Now there's different options and now we're going to be confused and now we're not going to want to drive because now there's so many options. But until I say, hey, we're going to drive to the grocery store because we need food for our house. Then you're like, oh, so now you have a reason and you have a destination. So if you're struggling with motivation, you have to figure out what is your reason and what is your destination. And no one will ever tell you this. This is the goal. That's the secret sauce right here. Like you're not gonna hear that shit anywhere else. What is the difference between ignorance and apathy? So ignorance and apathy, right? Ignorance is kind of like you don't know. Apathy is you know, but you don't care, right? That's the difference here. Dr. Joseph, hey man, good to see you. Bro, SSRI caused dependence. Excited to you tomorrow night. Shared on my socials. I did too. Yes, I've prepared a whole list of questions as well. So I'm excited to go into it. Yeah. Yeah. So if you're here, so this is Dr. Joseph. He runs a program on tapering medications, and his whole mission is to help people get off psychiatric medications. And he has a whole personal story with that too, involving the FDA and everything. So we'll go into more detail tomorrow night. He's got 100,000 subs, 121K on YouTube. So he's been popping off like crazy. And I think it's a really important mission, and sharing some of the dark hidden truths about psychiatry that, quite frankly, a lot of us aren't exposed to. Like, I wasn't exposed to in residency, so I'm learning a lot too. And yeah, so definitely tune in tomorrow at 9 p.m. Eastern Standard Time. Thoughts on Latuda? Latuda targets more. Latuda targets more treatment-resistant, bipolar depression. It's not really for mania, but it can be. Can OCD be overcome? Where do we tune in? Yes, you tune in right here on my channel. So 9 p.m. Eastern Standard Time, we'll be live. Yeah, it'll be on my channel on TikTok. But then the nice thing about that is it spreads to both audiences. So I met with the TikTok rep today. Yeah, so that's another story. I literally met with one of the TikTok guys. So they wanted to meet with me because they discussed going live and like how to improve that. And one thing I asked was like, okay, if I have a guest on, who does it go to? And he said it goes to both of the audiences. So that'll be really cool. Bro, lithium is for bipolar 1. It is, yeah. It's for bipolar 1, mania, bipolar depression, all of the above. Would you go over 60 milligrams Adderall if XR, if it doesn't last long enough? Yeah, I have some patients on 90. So some people are just fast metabolizers. Do you see the genetic tests on your patients to see which meds work best? I think that those are overrated. Personally, I think they're good if you failed some stuff, but it's not like I'm like reaching towards them the first time. What step methods do you use to approach first for 14-year-old boy before moving on to meds for depression? What step methods to approach first for 14-year-old boy? Get him some good role models. Really connect with him. It's funny. I was actually writing a book at one point, and I still have half of it done. It was called Level Up Mom. It's basically all about how moms can help their sons and how they can connect with them and how they can help improve their mental health, because young men need role models here. And, they're going through puberty. They're feeling lost. They're feeling confused. They are feeling like no one cares about them. Girls don't really want to interact with them, right? They have nothing that like draws them to them, right? They are going through puberty late a lot of the time. They want to run around, but they often get suppressed. So yeah, there's a lot of adolescent male struggles that are going on, right? And then they see really successful people and feel like they have to do that. So a lot of stuff that's really going on. So I would say just try to connect with them and figure out exactly what the issue is. Really bond with them. The most important thing you can do as a parent for your teenage son is establish a good relationship with them and find out what exactly is it that they want too. What are you drinking? Yeah, this is my turmeric and ginger tea. Turmeric Yeah, turmeric and ginger tea. Yeah. What causes restlessness, agitation, and difficulty sitting still? It could be anxiety, it could be ADHD, all of the above. Can Latuda help with sleep if taken at night? It's sedating, but it's not. Latuda's sedating, but it's not like super sedating. So it can help with sleep. Paris 664, how to get over a girl who rejected you and is on your mind 24/7. Bro, I think I answered this question already. I remember answering this question because I went on a rant on this question. I love turmeric. Yeah, turmeric's great for inflammation. I want a medication that helps me keep a job. Yeah, that's where you got to figure out what the underlying condition is, right? So is it depression? Is it ADHD? Is there even a condition? You got to do all of the above. My mom has schizophrenia. Would Latuda help? My mom has schizophrenia. Would Latuda help? Yes, yeah, Latuda definitely is used for treat schizophrenia. Most certainly. Can you talk about the difference between bipolar and personality disorder? Yeah, bipolar is like basically it's broken down into 3 phases. So you got a normal phase, a euthymic phase, and you got a hypomanic phase, and then you got a depressed phase. And like people alternate between the phases and they can kind of go up and down. But it usually happens over the course of weeks and months. It doesn't really happen like this. Personality disorder is like up and down by minute. What if you feel attracted to your doc? I mean, that's fine. As long as it doesn't interfere with the therapeutic relationships that you have. That's the most important thing. Can anxiety cause your body to lock in when breathing? Yeah, some people have panic attacks that way. Sheena says, I'm doing a podcast. I'm a big advocate for mental health. Serena says, how come you never see my comments? I mean, the comments are popping. They're flowing. You got to make the questions stand out, right? Instead of, you know, make them good questions too. So also the best way to really do that is, let me, how do I do this? Yeah, so the best way is to subscribe, because then if you subscribe, then I get a big notification that a sub is asking a question, and your questions will stand out above everyone else's. So if you want me to really prioritize your question, that's the way to do it. I have dizziness all day. That's not good. Top 3 favorite antidepressants. Wellbutrin, Prozac. Let's do one from each category. Wellbutrin, Prozac, and maybe mirtazapine, maybe clomipramine. Let's go with clomipramine. I don't really use mirtazapine that much. Yeah. Nice. Thank you for subscribing, Sheena. Appreciate it. Sheena says that she has a podcast. She's a big advocate for mental health. That's awesome. Congratulations. I'm here for the questions. For the questions or the drama. After intake, can we do 6-month Q maintenance session? Are you talking about ECT or just us? So it depends. It depends on what we're treating. Like if we're treating something casual, then yeah. Usually I do 3-month maintenance sessions, not 6, unless I get to know you really well. But if it's something that's more serious, then we have follow-up more often. No SNRI. Oh, I forgot about SNRI. Yeah. I would add Cymbalta, actually. I use Cymbalta a lot. Can you describe a candidate that needs anxiety medication versus one that would be fine without? A candidate that needs anxiety medication versus one that would be fine without? Yeah, someone who finds that anxiety is really affecting their day-to-day life, right? That would be a candidate who struggles with, who needs anxiety, right? It's all about the functionality. How bad is it affecting your life? You know, anxiety is a normal thing, but then severe anxiety is not normal. How come no doctors prescribe Ativan, they definitely prescribe Ativan. It's very common. Can you diagnose on a consult? A consult just 15 minutes, so not really, but a full psychiatric evaluation, yes. Yes, I can. So on a full psychiatric evaluation. So not on a consult, but definitely on a full psychiatric evaluation. Yeah. Yeah, and so the best way to do that is just to, I mean, you can see it in my bio. There's a consult link, so you can do that. Let's see, there's like a service thing too. Yeah, or you can just send me a message. That's the only thing. That's the other way. Go Jags, USAPA school here. Nice, nice. Congratulations. Is the PA school in the same place as the medical school? I don't even know where the PA school is in South Alabama. Yeah, is it the same building? I don't recommend ECT. It's for the right person. It's not something you just jump to immediately. Seroquel for sleep, not mood disorder. Okay to stop cold turkey. It depends on the dose. You don't want to stop if it's a high dose, only if it's a low dose. My old doctor won't. Yeah, it's different. How can I make a consultation with my mom? The best way to make a consultation is just on my bio. Yeah, you can make it for your mom there. It's like right beside the med school, but we had anatomy there. Oh, okay, got you. Yeah. So I remember like we had the med school, and then we had the parking lot, and then we had there's like the nursing school. Is that was, I think it was called the Allied Health Building or something. So are you referring to that? What made you choose this career path? Yeah. So what made me choose this career path? So I remember when I was in college, I was basically, I had my own kind of anxiety, confidence stuff going on. And then to change that, I'm like, you know what? Like, I remember coming home from one day from Christmas, and I was like, I want to join a fraternity. And I remember telling my parents, and they're like, okay. And so, I connected with the guy, and then, I rushed and everything. And then, I joined a fraternity. And so there I got exposure to like parties and girls and guys who were not nerds, and like a whole social life, a whole social scene. Every week we had events, mixers, like homecoming stuff, chapter meetings, leadership, like all of that. And so like it literally was like a full social calendar that experience gave me. And from that I realized, by the time I graduated, I was a completely different person. Like I was way more confident, way more social. uh, and I realized that, wow, I can actually change my personality, not like underlying personality, but I can change my confidence, who I am, how I express myself, if I take the right actions and expose myself to this stuff. And then I wanted other people to be able to have that same realization, that it's possible to change your thoughts by changing the actions you take. So basic CBT. Grace says allied health. Yes. Yeah, exactly. It's almost bedtime for you. No, actually, it's not. I woke up at 11 a.m. today, so it's not bedtime for me. Yeah. Yeah. Med school was fun there. So I did that. I went to med school at South Alabama. I remember we were. I lived like 15 minutes from the med school, and so every day we would drive in. We had a small class. We had a class of about 75 people, which is very small for med school. Most med schools are like 200-ish. The Caribbean ones are 600. So our school was tiny, tiny. So everyone got to know each other pretty well. And then I remember like when basically our routine was we would have a test every 2 weeks. So we'd study hard for 2 weeks, then we have a test. And usually the tests were on Fridays. So when the tests were on Fridays, then like the whole class would go out, and we'd go out to, there's like a street in Mobile, it's called Dolphin Street. And that's where we would go out and party. But it's like the same like 10 or so bars. And so it was like without fail, like we'd always be out partying after every test, for like 2 weeks, at least for the first 2 years, or at least for the first year, let's say. And then it kind of dwindles down once like second year kicks in, but definitely after the first year. Yeah, good times. That was like age 22 to 25. back in the day. Is psych competitive in the USA? Oh, it's definitely competitive. Yeah, psych used to be a specialty that no one wanted to go into, but now it's a specialty of yeah, no one wanted to go into psych, but now like people want to do it, so it's gone competitive AF. I started psychology. I loved. I stopped it. I had 2 kids. Yeah, exactly. So now you can practice it by going. You can talk about it on your own, right? You can talk about it on your experience. I remember I was talking to this kid, and this kid had OCD, and he was like, "Yeah, I want to start a channel. Like, I want to start talking about OCD, and like I want to help other people with OCD." And I was like, "Yeah, that's great. Like, you can totally do that. Just make sure that you only talk. You make sure that you tell people that you're a patient and you're helping people from a patient perspective. You don't want to misrepresent yourself as a provider." What year did you graduate? I graduated med school 2019. Are you going live with Taper Clinic on Psych Med Harm? Yeah, we're going live tomorrow at 9 p.m. Eastern Standard Time. 9 p.m. EST. We are going live. Beta blockers for anxiety, for job interviews. Yeah, I had a buddy who actually took a beta blocker, propranolol, for his med school interview, and he did great. We have our last final tomorrow. We're going downtown to celebrate. God, this is bringing back such such nostalgia. Are all the same bars there? The same establishments, or have things changed? Like back in my day, 2015-ish, I remember we had O'Daly's and Alchemy. Those are the top 2 I remember. And then there's some like biker bar. And then there was, I think there was like the drag bar. Yeah, those are the ones I remember. But yes, we are going. How long is residency? Residency is 4 years. What are we going to talk about? So we're going to talk about how to come off antidepressants, basically like the harms of it, what the industry doesn't tell us about antidepressants, and like, psych meds. Are psychiatric conditions overdosed or overdiagnosed? The lies that big pharma and FDA tells. Yeah, just that stuff. My opinion on PSTD? Well, you'll have to tune in tomorrow to see. How popular is nephrology as a desired specialty among young doctors right now? It's a good question. Are you a medical professional, or are you asking just like as a random person? Because that will influence how deep I go. Yes, those are still there. We go to Icebox. Icebox is not that was not there when I was there, I think. That must have come after my time. I remember O'Daly had these, I think it was car bombs. Yeah, they had the car bombs for like $4. And so, we'd celebrate. Like one person would get around and the other person would get around. And it came out to like $20. So it was very, very cheap. Okay, go Jags, yeah. No, it's a rare that a psych doc understands psych meds cause brain damage. It's just risk versus benefits. Like everyone like acts like it's like a mystical thing. No, it's just that meds have benefits and they have risks, and all you have to do is just assess the benefits and the risks, and you decide if it's worth it for you. It's just like chemo. Like if you literally just think about it like chemo, everything makes sense. Everyone knows chemo has benefit for cancer, but there's also side effects, and so you just decide if it's worth it for you. That's literally it. Ronnie says, "Go Jags!" Yeah, it was a good time. I had a good 4 years there. But I went to undergrad at UAB and University of Alabama at Birmingham. So sometimes I think, okay, should I have gone to med school there, or should I have gone to med school at South Alabama? So could have been either or. Sometimes I think about it, but yeah. Most people aren't warned on the risks of or withdrawals. Yeah, it's becoming more and more well known, right? But when people take an antidepressant or medication, they take it when they're struggling too. So like that's the time when they need it as well. It's not like someone just takes it for fun. Is it today? Is it okay to have hydroxyzine for insomnia if I drank alcohol 4 hours ago? Depends on how much you drank. One drink is not going to do much, but if you like got wasted, then I probably wouldn't do that. Evening. Lemur says evening. Hey, evening. Good to see you. Oh my God, I did too. Go Blazers. Oh shit. Yeah, were you in a sorority at UAB? I'm a student desiring nephrology specialty. Well, yeah, the reason it's not popular is because it's 3 more years. So it's 3 more years after internal medicine residency, which is hard and grueling. So imagine let me walk you through the timeline of becoming a doctor. So you graduate from, this is like the standard timeline, which is getting even more pushed out. So for example, for me, I went to undergrad at 18. I graduated at 22, went to med school from 22 to 26. That's when I decided to go into psych residency. Now, if they want to become a nephrologist, they have to go into internal medicine residency, which is 3 years. So that'll be 29. And then they have to do 3 more years of nephrology fellowship. So that's 32. So that's 6 years now. Internal medicine is already grueling AF, and now nephrology. And now they're not going to they make the same amount of money as an internal medicine doctor does. And they limit themselves to more opportunities because now they can't really do primary care. Like they have to work in a hospital setting or like the dialysis center or something. So now they're 32 at the minimum, getting out of it, making the same amount of money. So that's why it's not popular. I love Huntsville, Alabama. So nice. Yeah. One of my good buddies, he got married in Huntsville actually. So that's the last time I went, was when he got married. They had a beautiful wedding. They had this like, it was over some mountain, and the sun was setting over this mountain, and so we saw it, and like we all took photos and stuff, and yeah, it is nice. Love to see my healthcare provider on stream. Yes, yeah. We're going live. Yeah, I actually talked to I talked to TikTok today, and so they really like, I've been going live for the past 2 months now, and so they really liked that, and they want to help me like promote live and like really like kind of like make it into a bigger thing. So I'm excited. Yes, I was an Alpha Gam. Oh, nice. Yeah. I was a Theta Chi, back in the day. How are those boys now? What's their how are they doing? How bad are Lexapro withdrawals if you're on 5 milligrams for a year on day 6 and have been throwing up? Yeah, maybe you could have gone to 2.5. Like that could have been like the option 2. So like some people just need a little bit slower taper. Which exercise least likely to cause tinnitus? I'm not sure any of them. It's not really a common side effect. Tegan says, in med school and feeling lost, not sure which specialty to pursue. Yeah, I gave this advice to someone else. If someone put a weapon to your head, what would your immediate first thought be? For example, when I went to med school, like I knew that I was either going to go psychiatry or family medicine. Like those were my top two. And like I considered other specialties, but in my heart of hearts, I knew I was going to do one of those two. And by the time third year had started, like I already locked into doing psych. Like I knew in my head that that's what I was doing. Why don't big pharma doses now want to micro taper? I mean, you'll have to ask them. In fact, you can come to the live tomorrow and ask Dr. Joseph, since he used to work for the FDA. Oh gosh. You graduated. You graduated a couple years ago. Oh, okay. So it's not fresh. Okay. Yeah. So I was a founding father back in the day. So basically, what happened with our chapter was that it got kicked off a campus in the 80s. There was an incident that happened, and then the founding fathers came, or like people from nationals came, and they were like, "Hey, we want to reinstate the chapter." This was in 2012 ish. And so they came, reinstated the chapter. And so I was a founding father there. And yeah, so by the time I graduated, so I was part of the exec board. I was a scholarship chairman, and we were able to bring our GPA up. We were fourth on campus, and then we got to second, and we brought our full GPA up from a 3.0 to a 3.25. And so I talked about that in all my med school interviews. I was like, yeah, like we brought our GPA up. You know, we got these frat guys to really start taking academics more seriously, and I think they really liked it. And yeah, so I'll always remember my fraternity days, and I'm always gonna. It's been one of the best decisions I've ever made. So very, very happy about that. Psych is in my top 3. Really enjoyed surgery and OB2. Those are so opposite, right? Those are literally like opposite decisions, you know? So just ask yourself, what kind of life do you want to live? I said this to earlier before, but psych, all of those are not specialties that you just do casually. Like internal medicine, you kind of do casually. Family med, yeah, you can do casually. Like it's still hard work, but like you can kind of just go and whatever. You don't want to be a psychiatrist who doesn't want to be a psychiatrist. You don't want to be a surgeon who doesn't want to be a surgeon. For example, if you told me that I had to become a surgeon, I would literally drop out of medicine. Like I would not do a residency. I'd be like, no, I'm not doing it. Same with OB-GYN. I wouldn't do it. So it's like, okay, what do you really want to do? That's what you have to ask yourself. Best ADHD meds with least side effects. Right. Yeah. Basically, I told this earlier in the live. Someone asked me to, as they said, convince me to go into psych, like I was a med student, and I was like, if I need to convince you to go into psych, then psych is not for you. It's as simple as that. Nice. Peace out. Yeah. Holly and Mark, yes, I understand your views and your point, right? So I think coming tomorrow will be a better time for you to discuss these topics because it will be more, the conversation will be tailored toward this, Holly and Mark 7. Random find, but go Jags. Graduated from South in 2020. Nice. Yeah, I graduated from South in 2019. Yeah, that's when I graduated med school, 2019. Yeah. Yes, all these questions will be answered tomorrow, so that's the time to come in. Had a professor mention GLP-1s, but BED, the literature isn't there yet, but it could be a good avenue. Yeah, I've started using it for BED as well too. I just prescribed it to a patient. It's just hard to get with approval for it. Okay, Marissa says, why only coaching for PMHNP? Because, so when I started this about 2 months ago, I was getting on my lives. I just started doing live streaming, and a lot of people in the comments were like, "Hey, I'm a PMHP, and I need, and you know, no one ever taught me anything." I've had so many come up to me and be like, "Can you be my preceptor? Can you help me? Can you teach me well? Can you, you know, no one taught me psychiatry when I left NP school," and I was like, "This is a problem." And then I had a whole bunch of people in my live who were like, "Hey, I need, you know, can like I'm a PNHP and I follow you because like literally no one taught me anything, and I want to feel confident." And so that's what gave me the idea to get started. And so I think that that's the reason I'm focusing on them, because I think that's where the need is greatest. Like I remember when so, you know, so I was lucky, right? I went through a psychiatry residency. I went through a psych fellowship. So I've had structured training. But if you haven't had structured training, it's scary as hell, like trying to treat patients when you haven't had training. Like I remember in my 3rd year of residency, this was after 2 years of residency, and we started seeing patients on our own and in the outpatient world. And I was like, I had to learn all those patients, like a 100 patient panel, all by myself. I remember when I was in my inpatient rotation, we would go on call, and then we do like night shift calls. And at night, like I'm the only psychiatry doctor in the hospital, and so like if something goes wrong, like, I have to handle it, and like I'm trying to figure it out, like scared shitless, right? Like what do I do? So like I know what that feels like, and so that's why I made my program towards PMHPs, because they're going through the same thing. And it's like if I'm in a position to help you, and I think that the nursing school system or the NP school training system is so fucked too. Like they're basically just trying to take your money without trying to actually train you well. So, you know, there's a whole systemic problem out there. So that's what I want to do, is try to help solve that.
Right, it can't replace residency, and that's what my students tell me. They're like, "Yeah, we come out and like we barely taught us anything. Clinicals are online or not good, and it's not their fault. Like if you're a PMHP student or graduate, it's not your fault. Like the system is literally set out just to take your money and then like pump you out. Like that's what it's set up for. And so sometimes you get lucky and you have a really good preceptor at a good place. But if you don't get lucky and your collaborator shit or your precepting psychiatrist is not helpful or you don't have any kind of help or support, then like you're just fending for yourself. And so that's why I created my program, was because I wanted to help, people not fend for themselves, especially if I have the knowledge to help them. From an ER nurse, psych care is very unappreciated. Exactly. I had 1 year of Psych NP, realized I want to be a Psych NP. Yeah, yeah, exactly. A lot. So that's another problem in the industry. So a lot of NPs, or like especially Psych NPs, they may believe that Psych is easy, so they go into it, and then they find out, oh shit, like this is not easy. It seems simple. You can work from home, and you just gotta prescribe meds, but it's not easy. Like patients are complex and you can make a lot of wrong decisions, and the worst part is that you don't know they're wrong decisions. For example, like if you're in the ICU, you turn up the wrong dial or something, okay, the patient's desatting, like okay, immediately. But in psych, you might not know for months that you made a wrong decision. Way too complex. Precisely. It's complex and people don't realize how complex it is. That's the issue. From an ER nurse, psych care is very underappreciated. Thank you. Yeah, I think you just play to your strengths, right? Like I knew that I couldn't be an ER doc. I don't want to be a surgeon. So like this was my strength. So that's why I wanted to play to that. Took me 1.5 years to get a psychiatrist and therapist at the VA. Yeah, that's why I do. Yeah, it's really hard to get good care. And so, yeah, that's why I do like private practice online, right? So I cater towards people who like, they want to switch over from their other psychiatrists to me because they're like, either I can't find care or I find shitty care. Are you in Mobile? No, I went to med school in Mobile. How do I get off sleeping meds? Is Seroquel a good sleeping med? It's decent. It's good if there's like other mood disorder and stuff going on, but it's not the most beneficial. Talk about inositol and anxiety. Yeah, inositol can be used. I prefer N-acetylcysteine. I like magnesium a lot. Yeah. Best ADHD meds with least side effects. I mean, this just depends. It's patient to patient. If there's one best ADHD med with least side effects, then everyone would be taking it. But there's short-acting and long-acting ADHD meds, so you just got to figure out which one's the right one for you. Some people need it all day. Other people only need it some of the time. So they take more of a short-acting. So it just depends. I saw a lot of ECT. Can't imagine. Yeah. Seroquel 350, Zopiclone 20 milligrams. Yeah, that's a fuck ton of meds. I would definitely get that checked out for sure. 20 milligrams is a lot of meds. Temples feel like brain freeze and happens on and off throughout the day. What could that be? I'm not sure. That could be anything. Thank you for sharing. Depends if you're also a slow metabolizer or fast of the med. Precisely. It makes a huge difference if you're slow versus fast metabolizer. Yeah. How to counteract weight loss from ADHD med. Eat more. Eat before. Eat after. Passed my nursing exam. Congratulations. That's awesome. That is awesome. What do you think of ketamine? I like ketamine. I recommend it to people who they failed a couple things, and then that's when I recommend it to people. It's not like I'll recommend it immediately, but after the fact. Eat on a schedule. Yeah, exactly. Yeah, you just have to be scheduled. Okay, I think you need to see a sleep doctor. If there's no sleep med that's gonna touch you if you're on all that stuff and it's not working. Lexapro. Nice. Mic injections for weight loss, yeah. We already clock out in bedside. It's your turn to shine. LOL. I want to start an SSRI for a lot of anxiety, but I'm severely scared of PSTD. Yeah, it's all benefits and risks, right? Many people don't have PSTD, or you start something for like Wellbutrin. But that's not for anxiety, yeah. And then there's some that are least likely. So Trintellix is least likely to cause it. So much critical thinking in psych. Yeah, it is. It's critical thinking because it's ambiguous. It's not like you just follow the labs. Is eating one meal a day healthy? That's what I do. I eat one meal a day. I get all my I just have all my meals and calories in one sitting. So that's the way that I do it. Can you just stop Latuda? I would not just stop Latuda. No, that is not a good uh, solution. Fasting is done if done right. Yeah, yeah. I believe in I believe in fasting. The whole excuse me. Oh my god, I'm dying. I believe in fasting wholeheartedly. Yeah, so I do it. I fast 24 hours each day. You know, I eat one meal a day, right? It's really helpful for inflammation. And it's really, I'm also cutting as well, so it helps with that. I have ADHD and that's how I eat. I'll forget till I'm super hungry. Precisely, yeah. You have to schedule it. How do I get off Prestige? Prestige's a hard one to get off, so that's Desvenlafaxine. You know, it's a metabolite of venlafaxine, so you got to do it slowly. But the best place to ask this actually is tomorrow. So tomorrow at 9 p.m., we're doing a live. So this will be with Dr. Joseph from Taper Clinic. You may have heard of him on YouTube. He just blew up. His account's been blowing up, and he's got over 120K subs now on YouTube. So, you know, he's spreading a really unique message too in psych. So I'm excited to share this to discuss with him because I have a lot of questions too that I think you'll benefit from. So all the tapering questions are literally that's the best place to ask him is tomorrow. Excuse me. Is your program for PMHNPs or PMHNP students? Both. So we have a lot of students that have joined, and the reason is because they're like, my program's not teaching me anything, and I want to be confident when I get out of my program, because a lot of the more experienced psych NPs who've joined have told me that, hey, no one taught us anything. I'm just left to fend for myself. My collaborating psychiatrist sucks. No one, I'm just throwing 20 patients and no one does anything, right? I have to figure it all out. I have no training. And so that's why they join, because they're like, thank God I can actually discuss cases now with a psychiatrist. And so it's for both, right? It's for PMHP students, especially if you don't want to experience imposter syndrome when you get out of training, and for PMHPs too. And so like every week we do coaching calls where you can ask me questions directly. And because my goal for you is to basically download all my residency and fellowship experience with general psych residency plus child and adolescent fellowship into your brain. So that way, like we literally cover all the different medications, all the different